which will help the rest of your family sleep soundly at night.
The things men do for love.
And whether you suffer from asthma, diabetes, high blood pressure or even obesity, we'll be meeting the GP who's writing a brand new prescription to treat a whole range of illnesses. Also tonight, the man who dieted away 10 stone for a year is now back almost exactly where he started.
As ever, we do like to hear from you. Our phone lines are open for the next hour or so. That's Bristol 55 7788, 55 7788. Now, we start with this, the sweet sound of silence. Believe it or not, millions of people in this country crave it.
But from now on, they may be able to get it on the NHS. A special clinic to help give them the peace and quiet they long for has just opened in Bristol.
Three in the morning in the centre of Bristol. In the still of the night, there's one person fast asleep and one person fast running out of patience.
Sean, you're snoring on your side.
A little family drama enacted night after night in Sean and Lucy Courtney's bedroom. It may be the butt of so many jokes, but as Lucy Courtney will tell you, if you're married to a snorer, it's no laughing matter.
Oh, you see?
On your side.
I don't know.
Yes. It's a very big problem because he snores every night. So he wakes me up every night and every day I'm grizzly, I'm tired.
It doesn't really bother me, but obviously if it's stopping my wife from sleeping, really it's making life at home quite hard.
It's easy to underestimate, but in fact more people are kept awake by snoring than by this. For the people who have to endure it, the simple snore's even more annoying than this. And it threatens to break up even more marriages than this.
It's very loud. I mean, as I said, when he was in Spain, you could hear it through the whole house. I mean, he was upstairs asleep, he had the door shut, and all the rest of the family were downstairs in the living room. And they got their stone houses out there, and it was real bad.
But quietly, almost unnoticed at St Michael's Hospital in Bristol, surgeon Philip Bicknell has been performing a simple operation to cure the problem, and indirectly save who knows how many marriages. A technique only just being publicised by doctors in Cambridge, but in fact it was invented in Bristol 20 years ago.
I had a patient who came to me pleading with me to do something because he'd been on holiday in France and had kept the campsite awake. And I thought, well, this palate is vibrating, he's got a clear nose, there's certainly no problem there. And I thought, well, scarring the palate might be an idea that we could usefully employ. And we've done many hundreds of these patients over the years.
But that's just a drop in an ocean of snorers. Overall, it's reckoned that 1 in 8 people snores. Just lie back, open their mouths, and let their soft palates do the rest. The sound's made by the air passing across the palate, which flaps around like a loose sail in the wind. The result can be a roar of up to 69 decibels. The surgeon's solution is to make the soft palate harder by burning it. When it heals, the scar tissue which forms is stiffer and won't flap around. It's worked for hundreds of snorers, and now it's Sean's turn to have the operation. But first, he's got to be prepared for the operating theatre.
Is it really worth all this? I hope my wife appreciates this.
For once, as Sean sleeps, there's silence. Even the most ardent snorer doesn't make a sound under a general anaesthetic.
Now I'm actually applying this coagulating current to the soft palate in different places. You're seeing a small coagulation of burn mark on the surface of the palate.
5 minutes later, and it's almost over. Once the anaesthetic's worn off, Sean may have a sore throat. Then it's a matter of time for the scar tissue to do its job.
The palate it feels firmer already, but we won't be able to tell for some months before whether this has in fact worked and given him some relief.
Or more to the point, given Lucy some relief. After 2 years together, at last they can both look forward to getting a good night's sleep.
Gillian, will the snoring stop immediately after this operation?
No, the operation itself isn't a guaranteed cure, but even in somebody in whom it is going to work, it may take several months for the snoring to stop.
So are there other ways you can help your snoring?
Yes, lots of people don't need to go on to surgery to stop their snoring. Simple measures like losing weight, cutting out excess alcohol and checking with your GP that any drugs or medication you may be taking aren't aggravating the snoring are simple measures that some people just need to look at.
So your GP the best person to talk to?
Certainly the best person to start with, because if you don't respond to those measures, your GP can send you on to this new snoring clinic that's just opened in Bristol.
Of course, problems with the soft palate aren't the only causes of snoring. You'll remember last series we looked at the story of Terry Pascoe.
Terry suffers from sleep apnea, which meant that as well as heavy snoring, keeping his wife awake, he would actually stop breathing for as long as a minute at a time. It all resulted in a very bad night's sleep and severe drowsiness the next day. Terry was successfully treated by a sleep laboratory at the General Hospital in Bristol and now has to use this machine every night, which helps him breathe normally. So, Terry, since you've been using the equipment, how have things gone? Has the snoring stopped?
Well, yes, as far as I know. My wife doesn't complain anymore. And I do feel as though I've had a good night's sleep.
Does that mean that all the drowsiness and the other problems you were having during the day have also gone?
Yes, indeed. That's the remarkable thing about the machine, is that I'm able to sustain my work throughout the day and feel lively enough in the evening to come home and still play with the children.
So that's really good.
I think it's superb.
Well, we do have a special leaflet about sleep apnea, snoring, and ways to minimise the noise. If you'd like one, our address at the end of the programme. Now, don't go away, Terry, because we're about to get an update on how our 2 slimming guinea pigs are getting on, and you know all about that, don't you?
Well, yes, I do, but I haven't been very successful.
Well, a month ago, our 2 volunteers, Janet and Graham, started off on a new weight loss programme run by Bristol University.